Hi, and welcome to episode 113 of the Concussion Talk podcast. I'm with Corey Lewis, who is a physiotherapist at Mount Sinai Rehab in New York City. And before I talk to Corey, I'd like to just ask you all to follow me on social media. So at Concussion Talk, visit my Patreon page, patreon.com/concussion talk, and my newly designed website, which is concussiontalk.com, and subscribe, rate, and review for this podcast. And then before I talk to Corey, I would to thank my sponsor, HeadCheck Health. Concussion Talk podcast is presented by HeadCheck Health. HeadCheck Health bridges the gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Track Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck Health to improve communication and optimize care. Visit headcheckhealth.com for more. Okay, now Corey, thank you so much for being on here. We talked briefly on Monday about I wanted to talk to you about Super Bowl Sunday coming up and out this Super Bowl week, but then you reminded me that that actually was the Winter Olympics going on, and I totally forgot about that because as a bad Canadian, I haven't been paying attention to it. But first of all, I guess first tell us a bit more about yourself, about Corey.
Sure, Nick. Thank you so much for having me on. I really appreciate it. So like you mentioned, my name is Corey Lewis. I'm an advanced clinician physical therapist at Mount Sinai's outpatient rehab. I've been working here for about a little over 8 years now, with some experience in different settings, but right now my primary permanent spot is in outpatient, and I get a mixed caseload of both orthopedics and neurological patients. So I have a few certifications. Just one, I'm a board certified orthopedics clinical specialist, certified brain injury specialist, and a certified manual physical therapist. So I really appreciate working with patients that have had a concussion, because that sort of blends the different certifications that I have and really it's not an easy injury for the patient, but I really like to work with those patients because I feel like it's a puzzle and just kind of figuring out exactly how best I can help them get back to their normal everyday activities.
Great. Well, actually, I was going to ask you the letters after your name, but you clarified that, and you mentioned to me already on Monday that you were to the Braves and the brain injuries with brain injury there in Sinai, and sorry. I guess we'll start off with the initiation of the podcast was Super Bowl. So we'll start off with the athletes for the Super Bowl have had 2 weeks off now, and generally that's thought of to be as a good rest period, rest for a concussion. Like most concussions will clear up within, I don't know if I'm seeing a turn here, but within 2 weeks. But there's a big but or however. So should we talk about that, about the other issues that may be in play?
Sure. So that's a great point. The thing about concussion is because it's a brain injury, each person will heal sort of at their own pace. So depending on the severity of the injury and what the symptoms are, a lot of people refer to concussion as almost like an invisible injury. It's a little more functional versus structural, for the most part. And yes, you had either an impact to your head or to the body, but the head was involved, and the brain controls a lot of different things. So although 2 weeks is usually a time frame when most people can recover, they're still at risk of potentially getting another injury, as well as still suffering from some symptoms that can get flared up with any sort of return to play, exertion, or even just mental challenges as well. So
these players are obviously practicing a lot during these 2 weeks. So would that be a hindrance to the recovery if they were concussed in, say, the conference finals?
It definitely can be. A lot of times there are sort of specific guidelines, and each organization is a little bit different, but typically as soon as you first get a concussion, obviously there are rules in place for ruling in or just a suspected concussion. So a lot of teams have doctors that will do medical evaluations. They require monitoring and follow-up. And then initially, a lot of the advice is to sort of rest and gradually do kind of the minimal that you can tolerate. So maybe that's just a short walk of 10 minutes.
Yeah.
And not really to push it beyond that. And then it's sort of like phases, and each phase should progress a little bit more. So maybe going from a little bit longer of a walk to a little more cardio, where you might incorporate either a jog, run, depending on the sport, if it's maybe skating or something like that. Not really forcing yourself, but just kind of gradually building up your cardio to a specific level. And that's something that, again, they'll monitor to not flare up the symptoms. And then again, progressing from that point to doing a little bit more strength training, if they're able to tolerate that, or a little more resistance training, with the goal of getting closer to specific sport related activities, but non-contact. So maybe that would involve, for example, for the Super Bowl, they could be involved in a throwing or a catching drill, but not really with an offense defense sort of factor there, because you want to avoid any potential injury, again, whether it be from someone hitting them in the head or tackling. So once they kind of pass the non-contact phase, they'll gradually return to maybe like the contact practice, where it's a full practice with the team, but they still have to be able to pass that without any symptoms. And then once they're all cleared, usually by a doctor or some sort of medical professional, as long as everything's fine, they're kind of back, no symptoms, increased with activity. It'll be kind of getting back to that full game. And again, as long as they can tolerate that, they're able to kind of go forward from there.
Nice. And you mentioned that like if you hit again, it's obviously it's not really not good if you've been concussed previously, but would that necessarily exacerbate symptoms? So say if you were concussed and you felt the blurry vision, would being concussed again necessarily mean that your vision is now totally gone, or even more blurry and blurrier, like, or the different symptoms?
That can depend. It can definitely exacerbate things or make it worse than what they were. But if, say, for example, they were hit another time and it was kind of before the brain had the chance to recover, there is something that's known as second impact syndrome, which essentially is you had another injury to the brain and there's more swelling that happens. And that can actually be potentially fatal in people if it's really severe and the brain kind of continues to swell inside of the skull.
Yeah, no,
so,
there's a law here in Canada. About that.
So that's why there are a lot of regulations in place, and from pediatrics to the professionals, a lot of states have specific regulations so that they should be cleared and checked in on for each of the different phases, so that they're not kind of going about their normal routine and then all of a sudden they feel like, oh, I'm okay, I'm good to go. And then they get hit again and potentially have worse consequences after, or even a longer recovery. So that's always a main factor. And I get, for something like the Super Bowl, who's going to want to miss that once in a lifetime opportunity? But if it's your own health at that point, it's sort of weighing not only the pros and cons, but whether or not the doctors even clear you to return for a game like that.
Right. And because basically they're saying that the head is not necessarily directly impacted, but it's of influence. It's impacted secondarily, at least. So aside from everyone knows about like seeing a helmet hit is a bad news, or if you see someone get slammed to the ground, their head backs off the field, like it's obviously not good. But like, what other things can happen to someone on the field that would be, you'd look at them and say, oh, maybe a concussion, maybe you should take a look at this guy?
Yeah. So a good thing with helmets is that they do help the risk of like a very severe brain or head injury. However, they don't completely erase the chance of getting a concussion. So that is something that can still happen. And in terms of helmets, they have very specific ones, obviously depending on the sport. So even if someone's head isn't hit, they might have gotten tackled so hard that their body hits the ground, or even, just getting hit by another player in a certain direction.
Whiplash, kind of.
It's exactly. And there's a lot of overlap between concussion symptoms and whiplash. So for most people, it might be hard to distinguish whether or not maybe their neck pain, headaches, whatever symptoms they're getting, is that whiplash or was that actually another concussion? So the NFL, for example, has different rules, whether it's helmet to helmet. They try and minimize those sort of head impacts, or even just to avoid a defensive player from getting hurt. So if they're going to tackle someone, you obviously don't want to lead with your head. But it's something that if you do have a sudden injury with a severe impact to the body, it can also lead to some concussion symptoms as well.
And well, they kind of I don't know how it goes, and I see it fits both. The Winter Olympics are on now, and it's just it's too much that it's just as we were saying before. It's just amazing that these people don't get an injured more. We exchanged words about an article that I sent was about all the concussions that these skiers and well, it was skiers actually that were influenced by these head injuries. But I mean, what else? Because obviously concussion is like can influence every part of your body, and basically every part of your body can influence if you get a concussion. Obviously, you know, falling and stuff. But like if you break an ankle or hurt a knee, then that can be a few ways that can influence your concussion susceptibility in winter sports and football. So just talk about that for a second.
Sure. And I know for me, I personally have been watching a lot of the Winter Olympics so far, and just seeing some of the sports, you know, whether it's downhill skiing, the half pipe, which I'm always amazed at how they can go up, you know, 15, 20 feet in the air, come down, sometimes land on their back, you know, their head drags along the half pipe. There is such a risk with a lot of these sports. And the good thing is, again, most of them are wearing helmets for specific sports, but if someone falls and their main concern is, oh, I hurt my knee, but maybe they came kind of tumbling down the mountain or down a steeper path on the half pipe, that's something that maybe all their focus was on their knee at the time. And they're sort of not necessarily paying attention to, why am I getting all these headaches? Or why is my vision blurry? Or why am I thinking a little more slowly or having trouble getting words out? Which for them, they're just maybe frustrated because their opportunity at a gold medal has just kind of been crushed. But now it's all right, well, maybe there was another injury there. It wasn't just your knee got hurt, maybe you had a concussion. And that's something that a lot of the video recordings help with too. So, you know, having the films to look back at, having sideline doctors to help rule out those injuries. But if the athletes don't admit to that also, that's something that puts them at risk of, you know, getting injured again, and that whole starting the whole second impact syndrome conversation one more time there.
So do you guys spend a lot of time in the outpatient or in your inpatient rehab, whatever? By the way, about awareness because I know, like, say for the Olympics, the lots of medical staff there, which is great and well paid and stuff, but they're not like, I mean, NFL is different, totally different animal, and the NFL has money to burn, and not that they would, but you know, but they have lots of money. So these athletes are, say, amateur, may not, and they just play once a year, and once every 4 years, and they're just eager to be there. And they're always very young, obviously in the teens. So do you spend a lot of time, or do you know if they spend much time on awareness for how much, say, if you're like 18 years old, you go to these games and you injure yourself, and you got, gosh, you're like, oh, it's fine, I'm gonna win, I could win the gold medal, so just plow on. But realize that when do you think, oh, I'm not gonna be from 40, that's ancient, I'm never gonna, who cares, I'm 40, but then you get to 40, you realize I haven't lived half my life yet, and I'm just like, this is it now. So, you know, so awareness is such a big part. And do you guys spend a lot of time teaching about awareness? And what do you teach when you teach about awareness?
Yeah, that's definitely a great question, because that's something that, especially at Mount Sinai, and I feel like throughout different health systems at this point, concussion awareness is such a big piece, whether it's educating schools, teams, making sure coaches, parents, family, friends know how to kind of recognize, is someone presenting with a concussion? Were there signs and symptoms that, you know, you saw them either get hit in the head, they had a fall, or even just allowing people to understand that they should be honest with their coaches or whoever if you do hit your head outside of a game or practice, and then you go to your practices and now you're having these concussion symptoms. Maybe you don't remember plays, maybe you can't react as quickly to things. So there are a lot of things we try to kind of educate not only our patients. So any patient that comes in, I explain the importance of how much, as for me specifically a physical therapist, I can assess them and make sure if there are things that I think they need to focus on or give themselves a little more time to get back to doing. So say, for example, I get dizzy every time I turn my head, or I can't really follow things with my eyes because that flares up my symptoms, or these headaches are so severe I can't focus. So knowing maybe it's a change in school, if it's a young athlete, they might not be able to go back to school right away at their full level, or work for an adult.
Yeah.
So making sure that they know that there are things that they should do to help minimize that increase in symptoms. So just kind of getting out there, advocating for how much, just as healthcare professionals in general, we can really offer to patients that have had a concussion. It's a very multidisciplinary injury. So there are a lot of different providers that can really work to improve symptoms, whether it be a physical therapist, occupational therapist, speech therapist, neuro-ophthalmologist, physiatrist. So there's a lot of different areas, but for everyone to work together, I think that's also what we've been trying to push here at Mount Sinai, so that we do talk pretty often. We'll message the doctors if we have concerns, or we'll send them our notes just so they know exactly how the patient's progressing. Patients often ask, because they know how involved their symptoms are, maybe they're seeing 2 or 3 professionals in a given week, all for their concussion symptoms, and they want to know that we're communicating. So that's something that for us, we really have to make sure that our communication amongst each other is as thorough as it can be for the patient.
And towards the more objective assessment of concussions, I know you'll get, as a physio, you'll get obviously notes from doctors and from physiatrists now, and your occupational therapists and your nurses, whoever, and maybe even parents, or maybe even the people themselves, but chances are you won't. But I mean, do you think that the baseline testing, or any sort of testing, first of all, make to get a good, or basically get baseline, is a good word as I can use, but baseline testing, you think that's really important, or do you think it's just good knowing but the symptoms there?
Yes, that's a great point. So baseline testing is definitely something that I think is becoming more popular. It's been around for professional organizations, but I think schools are definitely doing that a lot more. That's something we want to, again, as healthcare providers, really encourage, that teams are doing it at the beginning of the season, and you just have that baseline information. So you can tell, well, all right, compared to back before our season started to you just got an injury the other day, so you had a concussion. Yeah. We want to know, are you having major changes? Maybe you don't feel that you're completely off. Maybe you're not having a ton of the more physical symptoms, like, all right, I'm not having a headache, I don't have neck pain, but how quickly are you having like cognitive changes, which that can pick up on some of the baseline readings as well, which, look at different things, whether it's how someone can kind of move their eyes quickly, if they're having trouble with any short-term memory issues, recalling plays, that sort of stuff can be impacted. You'll see how their balance is. So if maybe their balance is off and they do go back to something soon, that puts them at risk of another potential injury, whether it not be a concussion, but maybe you fall and hurt your leg. So baseline testing can really help just to give sort of an objective value as to where they were pre-season or pre-starting whatever activity it was. Yeah. And then comparing that to kind of normal ranges for specific ages, and just see, all right, well, how do you compare to this? If there's major changes, I don't think you're quite so ready to go back yet, especially if you are having symptoms.
I know there's not a discussion between the argument between concussion prevention and concussion treatment, but there seems to be, it seems to me they're kind of more odds, just like, don't let them do this, don't let them do that, just, and it's, but also knowing that, raising awareness for everyone to say like that, if you do this, you're going to hurt your head, and it's not just going to be, oh, I'm out for a few months or whatever, but it could impact you totally for the rest of your life, and just take care of you. You only have one brain, all that stuff, but as we see in like football and like in these sports and the Olympic sports where there are a bunch of teenagers. I mean, you're not going to tell teenagers that they'll be hurt when they're 30. What do they care? When they're like 14, they're mental and they're gonna live forever, and who cares? So,
Yeah.
30 is old, 30 is ancient. So that type of thing. But do you find that when you're raising awareness about both prevention, not really necessarily prevention, but from about the minimizing risk of concussion to young athletes and them, and they getting proper treatment, do you find the different conversation between kids, which I don't know how much you do with kids, because you're with, I assume, more adults, but do you find as much difference talking to kids and adults, and but what would you say to them?
Yeah. So I definitely tend to get more of the adult population, but I get some adolescents, some younger patients every once in a while. But a lot of it's the language. So for them, they're in school. They're in school. Maybe they play a sport. Maybe they play an instrument. They have all these different activities. So for them to understand, well, why is me hitting my head right now going to affect me for a while if I just go out and keep playing? It just hurts right now, or I just feel off right now. So it's really just explaining to them, you are still growing. There are some changes that can happen. So we just don't want to limit that with your body, and making sure that you can get back to doing all the things you love to do, whether it be playing a sport or different instruments or, school in general. So by having them rush back to playing a sport or doing something that puts them at risk of injuring themselves again, it can potentially take twice as long or 3 times as long, or, can be an ongoing thing. So it's really trying to relate to them. And obviously everyone's a little bit different with how best they understand, but education on prevention and making sure that schools are aware of that too. I know that certain schools have a lot of policies and education that's kind of built in now with different training regarding concussion. Teachers are going to have to be a little more accepting if they have to change. Maybe they can't do that full day of school. They might have to start with a half day, or, minimizing certain, like gym, for example, so they don't get risk of injury again. But I think the prevention is really key. So specifically for maybe like a younger patient, it's also talking with their parents, which for them it's, okay, well, I get that they have their championship game this weekend, but how would it be if they got hurt again and this potentially was worse this time around, and then they couldn't play for, who knows how long? So it's really kind of putting it into perspective that they'll understand, that, again, most people will recover on average in a shorter period of time. But again, you don't want to be that one person that really pushed it too soon, and then now all of a sudden it's just prolonging all of their symptoms.
Yeah, no, that's a main. That's exactly. I think it's a delicate balance between people pushing, pushing through it and all that stuff, language, but like, which is not good. But like to say that, and then just make sure everybody just sits out when they get hurt at all. Like, it's not necessarily. I don't think it's very reasonable or very to think that people will, because especially adolescents, when they're just, except about being able to play, and that mostly, have you talked to people, like between people, see who've had friends like football players or hockey players, or anybody really who has a friend who's been concussed or injured, and is it time for how they realize that there's a risk of injury if someone who get very badly concussed and they're just concussed, so you find that's a bigger, they're more serious about their recovery and their physio and whatnot.
Yeah, I definitely think that's something that's also pretty common, where if people know of someone else that potentially had a concussion and how severely that impacted them, or they compare themselves, well, why were they better in 2 weeks, and for me it's taking a month or longer. So you see both sides of it, where that's important as well. And you educate and say, even if it's talking to your friends who are really pushing you to come back to play and they want you in this game, it's kind of, you're on your own course of recovery. So you, again, can't really compare yourself to the next person. Everyone's injury is going to be a little bit different. So while you want to say, I know this person who got better this quickly, I should be
Yeah.
better. That's not
Yeah.
always the case. And that's a lot of what I talk to my patients about. And letting them know that for some of them, they feel like, this is sort of like a big burden. And I
Yeah.
always have to go to these appointments and I can't do the things I want to do. And it's changing, my everyday life. It's ideally, you have that conversation where you want to say, we're working on getting you back to doing it. I know it's not as fast as you want it to be. Most people
Yeah.
want to be fixed yesterday, and here we are today, still having bad symptoms, but it's kind of allowing your body to heal and just kind of gradually pushing, getting back to your activity level without those really bad flare-ups.
And if this actually, this is just a more physio question, but say if someone comes to you and they are playing any sport, I shouldn't say playing a certain sport, but they're activity where you think maybe concussions are more of a risk issue in this bigger sport. What they come to is that they just first injury they sprain their ankle. How would you rehab them thinking about concussions, thinking about their obviously you rehab them just in general, but would you say to them, hey, make sure your stabilizers are good because
I definitely whether it's someone coming in with an ankle sprain or, a knee injury, I won't necessarily jump right away to concussion, but I tell them of the risks of going back too soon of, maybe your balance will be off. And maybe, if you overdo it with something, I always just want to make sure that not only is it the problem they're coming for, I kind of look at the full body when I'm approaching a patient and just say, well, based on what I'm seeing here, this could potentially kind of throw you off if you get back to running or jumping. So I want to kind of look at the whole patient as just as a whole in general. But I would say for certain patients, they might be a little bit more at risk. Again, there are more contact sports, but
yeah,
it could just be, I stood up and I hit my head on a low beam, or I, had a slip and fall and hit my head on something. So with any of those things too, I'll educate my patient if they did have a fall, because that happens sometimes where someone comes in for something else and they mention, I slipped the other day. I always ask them, well, what did you hit? Did you hit your head? That's usually one of the questions I
yeah.
always ask, in addition to what other areas, to see if something has changed. But, I'm always kind of looking at the whole patient and really making sure that we're not missing anything that would put them at risk in the future for any sort of injuries.
Right. So finally, another physio question. What type of injuries do you see at your outpatient right now? Like you would just in this time of year, February, in the winter,
Um,
more. Sorry.
in this time, there's no one specific. I would say my caseload is sort of all over the place, where I get a mix. I'll have brain injury, I'll have stroke, spinal cord injury, and then on the other hand, I'll have an ankle sprain, back pain, neck pain, shoulder pain. So there's no one set increase right now. I would say some people with snow are a little bit more likely to slip and fall, but that can result in different injuries, whether it be they hurt their back with their slip, or maybe they hit their head and they did get a concussion, or, broke a bone, that sort of thing. So I think that's probably what I like about how I have so much variety in my caseload. It's kind of
Yeah.
always changing. And the way I sort of approach every patient, it's sort of like a puzzle and not just
Yeah.
treating that one area. It's sort of, can I get them back to doing whatever they want to do? So I do like having that variety in my caseload every day.
Right. Yeah. No, I'm actually asking Dr. Cancel in December. I said, well, you must see a lot of like ice injuries, slip and falls. So he's like, well, not as much as you think, because people are more inside and they're
Yeah.
in New York City, especially. I'm sure I think taking care of the streets and stuff. There's not as much ice around as there is in my city. There's lots of ice, but now it's too warm for ice. But
Yeah.
yeah, but so you said you were watching the half pipe last night, but are there any sports and athletics that you like watching, or do you like watching? First of all, I try like all of them, but do you particularly like, or that ones or ones that particularly say to you, oh, this guy's gonna hurt themselves badly if they, except for obviously the half pipe stuff like that, but I mean like any of their more, I'll say, to say regular sports.
Yeah. So I would say obviously football, hockey, they tend to be the ones that are a little more aggressive. Soccer, you're heading the ball, or it's, it can get very physical. For me, I grew up playing basketball. I was always kind of either boxing people out, and there are times where you might get an elbow to the head, or
Did you ever hit your head
come down.
ever hit your head on the backboard?
Luckily, no, which is
Luckily,
I'll say that
it'd be
that's a
impressive
plus.
though.
Yeah, luckily, no. I've definitely come down and sprained my ankle a couple times in the past, landing on someone's foot and all that. But in terms of specific sports, it can really happen with anything. Again, whether you're skiing, snowboarding, you might just have a fall, slip, and kind of take a tumble and roll. But I feel like I've also, in the past, I've played volleyball. I've dove in beach volleyball, kind of got up a little, maybe I kind of landed and stretched out a little more than I should have, or trying to block spikes. It can really happen with a ton of different sports. But when I do watch, I'm always on the lookout for different injuries. And I think that's sort of the PT mindset. You watch people run, you watch people walk, and I'm constantly analyzing. It never turns off.
They're gating all this stuff, and like where the
I go into Central Park and watching people run or walk. It's one of those things where I can't turn off that part of my brain. So then it kind of goes, well, what do I think's wrong? Why are they running like that? But that's something that I think as a PT, it's pretty common. So.
Yeah. So there are any sports there? I mean, you mentioned snowboarding. So do you snowboard or skateboard? And so that's how I word. Any of that?
I've skied downhill skiing, never got into snowboarding. And again, I'm not an intense skier, but there were times where, especially when I was learning more, I would have some falls, and no major injury for me, but I can definitely see how many people, especially once it gets icy or even just colliding. So if you go on a busy day and there's a lot of people that, especially if it's on the easier trails where people are learning, you always are kind of avoiding people so you don't get into a crash as well. But yeah, definitely I can see it with a ton of the winter sports. But I think it's good because
there's a ski sport that I've seen that's like newish. Not saying newish, like not 10 years ever really, but that the ski cross, which is that's just begging for a bad injury. That's remarkable. But the impressive thing of these athletes are that's in their feet.
Yeah, I've seen that, and I think that was actually on the other day when I saw that as well. And they have like the blue lines built into the course, which they always talk about it as they're commenting. Just that it's there to help the athletes, so they know when there are those changes in terrain, or if all of a sudden there's a turn, so they're not going to be more likely to get injured. But it's also kind of built into those areas where there might be a jump and then they're landing. So I think a lot of the winter sports are doing what they can to help minimize those specific injuries, but it is always something that, it can happen.
It's why the sports are why we watch those sports, because they're just crazy and dangerous, and that the athletes do stay on their feet or do survive generally. That's just like that's what makes it. That's in winter sports, it's more like 50% of the battle is just staying around.
Exactly. And I can imagine going off a big jump and having to spin 5 times, flip upside down, and land and still be fine. But hey, they do it and they make it look good. So I feel like that's what keeps drawing everyone back.
Exactly. Yeah. So thank you so much for doing this podcast. And is there anything else you'd like to add, either your Rehab link or your work, or anywhere people can reach you or do that?
Yeah. So, I mean, I love working with patients that have had concussion before. So if anyone has any questions, you can email me directly at my work email. It's corey.lewis1@mountsinai.org. As well as if people have questions about referrals for concussion at Mount Sinai, we have a specific email address for that. It's concussion@mountsinai.org. And that's usually they're connected with a coordinator who helps just set up any sort of evaluation for patients that have had a concussion. But again, I'm always open to talk about concussion all day. Send me emails.
Great.
I'm happy to look through it. And,
Great.
I really appreciate being on here, Nick. This is a
Oh, no,
great
thank
way
you
to
so
talk
much.
about everything.
Thank you so much for doing this. And also, I just want to mention that I'll follow you on Twitter, not you this way. I'll follow you on Instagram, but on Twitter and Instagram, there's the Mount Sinai Rehab and Performance, or Rehab. I don't know the handle is, but I know
Yes.
they're on both Instagram and Facebook and Twitter and Facebook, I assume. So
yes. Yeah. So you can follow them on Instagram. It is, I believe, Mount Sinai Rehab. Let me just confirm that.
Yeah.
But yeah, we are always, putting up different things regarding to the rehab world. So it's at Mount Sinai Rehab. So that's MOUNTSINAIREHAB.
Awesome. And you're the second physio, the third person from Mount Sinai that I've interviewed. And I will interview Tracy, your I don't know, colleague, if she works in outpatient or not, but Tracy Lynn, about craniosacral therapy in the next few weeks, which will be
perfect.
And
yes, Tracy and I work very closely together, and that'll be a great podcast as well. I'm looking forward to hearing that one.
This be honorable. If you listen to this, it's Friday, or at least Friday. Hopefully, listen to this before the Super Bowl, because that was the first half of the conversation. So, but yes. And do you have any picks, or do you care enough to really make any picks, or for Super Bowl?
You know what? I'm kind of hoping the Bengals pull it out. I'm hoping the Bengals win. It's been since the 80s, and I think it would be good to see Burrow win.
Are you in Ohio or Cincinnati native?
No.
You're not LA though.
Nah, and nothing wrong against that, but no, I'm born and raised in New York, so I'm a native New Yorker. Which I mean, we won't talk about the NFL season this year, but
okay, well, that will end our podcast. But thank you so much. Thanks a lot.
You're welcome. Thanks, Nick. Have a good one.
You too. Music at the beginning of this podcast is by Ben Sound. www.bensound.com.